to be an astronaut and
That's one small step for man, one giant leap for mankind. Columbia, this is Houston, ALS, over.
Houston, Columbia, Navigate, over.
Roger, the EVA is progressing beautifully. They're setting up the flag now. I guess you're about the only person around that doesn't have TV coverage of the scene.
That's all right, I don't mind a bit.
They got the flag up now, and you can see the stars and stripes on the
Flag
wing.
up now. You can see the stars.
Are you getting a TV picture now, Houston? Neil, yes, we are getting a TV picture. You're in our field of view now.
I'd like to evaluate the various phases that a person can traveling on the surface. You do have to be time to think about you.
thank you very much. And so, for those of you that are wondering, that's physical activity research in an awkward place to get to. But I wanted to be an astronaut, and that was one of the first of many failings that I had. And I was very disappointed in 1969 when Neil Armstrong beat me to the moon, and I was a bit tall as well. So it meant that this quote from Winston Churchill has always resonated in my life, that you've got to bounce between failure and failure. And I do like to maintain my enthusiasm so people will appreciate that is true. And as a football umpire, that was good training for referee reports from scientific journals and promotion and tenure. Getting abused by 80,000 people is very good for your character development. So rather than present a research about tendon research or bone health research or physical activity, because of the diverse interest here in SMA, it's a multidisciplinary conference, I wanted to touch and take the liberty of touching on this thing of success, which is a bit awkward to talk about because there's sort of that implication that you know something that you're going to talk about. But really I'm bringing the literature to bear and other people's success stories. And it's such an important area that I thought someone had to grasp the nettle and touch on some of these things that haven't been the topic of a Refshauge lecture before. But the way the lecture is organised, I'm going to start with, these are the three sections of the presentation. And the idea is that we're going to try and target the young clinicians and the younger investigators in SMA, particularly in the first sort of section, because experts in the room have been successful and they will be able to share their experience at other events over the week. So this is a catalyst and something to discuss. We're trying to target the mid-career and beyond folks because they're going to be in leadership roles and are in leadership roles. And you don't need to be the formal head of something to be in a leadership role. Leadership comes from all chairs. And clearly with ISPA being here, it's a great forum for them to see how ISPA is leading the world and can be leaders internationally. And I'm a member of ISPA, but I'm not any sort of formal person as far as physical activity and health goes there. And I'm going to share some resources on the way. So that's the structure. So, I know you love participation activities, and this is, they've given me a long slot. And so rather than having to do participation makes a big difference in terms of engaging, as you all know, and we're preaching to the converted here. I know you're all experts and very accomplished. And so I'm going to ask you to discuss one key factor that's contributed to your success, and think about it that you're giving the graduation address, which some of you, many of you will have done, and you will have thought about this. And your job is going to be to highlight one key factor for your success. So we'll just get you to discuss that in pairs. It's the Think, Pair, Share activity. And it's a good chance to meet people because not everyone knows everyone here, so this will be a chance for people who have had the courage to come who don't know people to meet the person next to them. And then we'll just discuss that some more. So you've got 2 minutes for that activity on timing, and then I'll come back to you after you've had a go. The thing you might like to come up with, and I'll come up with the biggest priority at the end, but this is under the why do you rob banks category. You know that question, it's a classic question, why do you rob banks? And the answer is because that's where the money is, right? And so in terms of learning, you've got to choose a big problem for the long haul to be successful. And that's pretty obvious, so we'll move through that. And a good example of that is someone like Jill Cook, who was a former Refshauge lecturer, and so she has obviously chosen tendinopathies as a big problem. Ken Fitch, asthma, last year's Refshauge lecturer, and all the keynote speakers here that we're privileged to learn from over the next few days, and what a wonderful demonstration there already was of that today. So that's the big problem. Now the second thing is to skate to where the puck is going, and I actually don't know anything about pucks, and it's potentially dangerous, this whole puck conversation. So I'm going to move on from that, but it's clearly related to anticipating in football, which I'm more familiar with and was bad at. And the people who you're hearing from as the leaders in the field, when they started their area, they weren't the leaders in the field, I can guarantee you, because that's part of the deal of being innovative. Okay? So seeing Jim Salas there, he's got a psychology background, he got into physical activity, he got into measuring physical activity objectively early. I haven't spoken to Jim about this, but I guarantee that when he was starting to measure physical activity objectively, people were saying, what the hell are you doing? And people never do it. And there would have been a bunch of things saying why you can't do that. And that's one of Jim's strengths, is that he's been a great leader in that particular field. And that is replicated all over the room here. So you've got to be prepared to take the knocks and people telling you that you're wrong. And there's the epitome in some ways of someone who's been told that he's wrong. Lots of times and vehemently, and I know there'll be exercise physiologists in the room who disagree with Tim. He happens to be a good personal friend of mine, so I know about his principles to success. And there's his Twitter address. He's just an epitome of someone who has done his work, he's seen what he sees as the innovations and the questions that need to be asked, and he's stuck with them irrespective of the weight of criticism that he's had. So just a little bit of speculation. I'm not trying to predict what the big things are moving forward. In my history, we've done some okay things that have led to some success in us moving to areas that weren't super popular. The first one there is meant to be a little bit controversial, so that Roger Anoka and other folks can say that there is a big future in molecular biology for public health, if that's your position. But just in the interest of time, the point here is that you've got to try to anticipate what the future is, and you'll learn those things in the original data sessions and in conversations with people at this meeting. Now, this idea of differentiation is the third of these 5 bits in the first section, then we're done. And it's an important word, and it's not a word that we use in healthcare and research that much, I don't think, differentiation, but it's a very standard concept, and it's not foreign to us. So again, I won't labour that, but for the sports injury prevention research conference here, Roald Barr was a regular sports physician, did the full service thing, and wasn't well known. I'm going to say he was a pretty ordinary sports physician in the regular dictionary sense of the word ordinary. And I can say that he's a good friend, and he won't mind me saying this, but they got focused on sports injury prevention before anyone else did, really. And so they got away with all they ignored the treatment and all the other stuff. So we're going to be about prevention. And so they totally went after that in 1999, and anyone in the sports injury field will know that they're the leaders in sports injury prevention, have done a bunch of fantastic studies. So if you look at the sophistication of their methods on the y-axis, just as a just a measure of how sophisticated it is, or potentially dollars to do those studies, and then you look at the number of studies, you want to have an excellent study. And so what the Norwegians did is they moved up from descriptive injury epidemiology to prospective cohort studies with risk factor identification and then RCT. So again, that's just an example of differentiation and getting to excellence through differentiation. So getting back to my failure as an astronaut, and Neil Armstrong, when he died, the quote at the bottom there is, "There can be no great accomplishment without risk." And of course, when you differentiate, it's easy to say that, like, differentiate, good for you, but you're walking away from a bunch of stuff, and you've got to have the courage to say, I'm not going to do X, and that's what is actually hard. And so, in terms of innovation, that was one of the things that came up in the discussion. People were saying success was due to innovation. And innovation is often thought of as being the idea you get in the shower. And it's good in Australia because they have lots of showers. And it's hard in Britain. But it actually can be more systematic than that if you think of dimensions, and one of my mentors made the point that in research, and this can apply to clinical settings as well, where you can differentiate yourself in these ways, that you're either going to have an unusual population, so you might focus on a disease, and that might be concussion, it might be tendinopathy, for example, become an expert in a disease group. It might be a population where you develop expertise in taking care of injuries of kids, or haemophilia in kids, for example, crossing over there. And then often methods and technology are where the innovations are done, such as imaging, or at the moment with GPS and engineering of sensors in all these ways, developing apps, okay? So if you think of those dimensions, you don't need to do all three when you're trying to innovate, because in fact that wouldn't be effective and you wouldn't have the resources, but you often only need to innovate in one of those areas to be hugely successful. And so if we think of a basic sports injury situation, again, football epidemiology, there's been millions of football epidemiology studies, a bit of exaggeration, but a lot. And if you're in that field now on the sports injury side, then what you might do is work with a particular disease, such as hamstring as a big problem. You might have superior methods, such as the risk factor analysis, so measuring strength in novel ways. You might image superiorly, or you might do superior treatment. So you can see how that could work, and that shouldn't say functional there, it just should say MRI as a method for characterising hamstring injuries more carefully. Hasn't been done in the RCTs so far for hamstring injuries. So the concept is just the box with disease or treatment as the top of that box. I can't draw 4 dimensions. But thinking about innovation more logically and rationally and more predictably rather than waiting for the great idea. So that's sort of a checklist. When you're thinking about your research, for example, make sure you're dealing with this. You might think, well, it's obvious to choose a big problem, but if you're a supervisor and you're young, if your supervisor has an interest in something, you tend to sort of mimic that a bit. And that may not be where the future is going to be over the next 20, 30 years. And then the fourth of these is to say no to 999 things out of 1,000. This is, comes out of a biography of Steve Jobs, actually. And that's the one I'm struggling with, to be honest. So I'm like an alcoholic. My name's Karim and I'm an alcoholic. And so this is very much work in progress on my side, but it's a good sort of concept. And you can see with those first 3 things we talked about, you're going to come into vogue because you've had your innovation, and people are going to want you to contribute in a lot of ways. You're going to have to figure out how to do that. And the tactful saying no is definitely part of that. And then I want to just celebrate Bill Vincenzino, another fantastic Australian physiotherapist who I'm a big fan of. And I talked to him about this particular presentation and wanted to get his tip. And he's really saying that if you just totally commit and focus and work extremely hard, you can do particularly well. So, and he's demonstrated that very nicely. So the last part in this section is to move to partnerships, and I actually think it's the most important personally, but it just flows into the teams. So I put it as number 5. And can I just see who's read this book, Outliers, already? Please put your hand up if you've already read this book, Outliers. We've got about 1/3 of people who've read it. And, what I find liberating about the first thing is not everyone agrees with Malcolm Gladwell's points. And so he's a journalist and he's synthesised the literature in his way, and he tells it as a very good story. So he's not trying to do a systematic review, but he tells an engaging story that you can read in 4 or 5 hours, and it's a good read about success in business and sport and music, and it's a great story. But not everyone agrees with him, but that's okay. But the liberating point about Gladwell's work, and it's what some of the people said in the room, if you're in the good context, you can be very successful. So if you surround yourself with the sort of people that are at this meeting, you can actually do very well, and that's more important than your own genetic talent. And to say, well, there's a threshold for genetic talent, and so he talks about IQ, and he followed people who have IQs of 190 and things like that, and they didn't do better than people who have an IQ of, say, 130, 120. There's sort of a threshold, and after that, IQ was irrelevant. So it's a sort of threshold phenomenon in terms of success, as you measure it in one way. So Outliers is a critically, I recommend it to you for a read. I think the concept, I use it with my graduate students, I call it the Outliers concept. Are we in an environment where we're getting good input? Anders Ericsson was the one who Gladwell quotes about the 10,000 hours. Ericsson's a psychologist who doesn't actually use the 10,000 hour term, but saying that deliberate practice, not just random practice, but very, very focused practice can make you an expert. And that raises the issue of nature versus nurture and allows me to sort of flow into Malcolm Collins' keynote on Friday, because Malcolm's part of this very heavily downloaded paper from the BJSM about the contribution of genes and sporting success. And Malcolm's the geneticist, Ross Tucker's the physiologist, and Malcolm's talk is about biological mechanisms more broadly. So you'll enjoy that, Malcolm, on Friday. Okay. So that's sort of an illustration that we want to be surrounding ourselves by successful people. And in terms of personal demonstration, you know, Steve Blair, Velleman Mecklin, both been critically part of ISPAR over the 4 meetings, have been very generous in their support in building our environment in Canada. So I want to take a chance to say thank you there. And then the last part here is to combine these skills. So this is an example of partnering. So you've got Jill Cook, who's a physio, who's great at clinical populations. She's learning molecular biology, but she's not an expert at it. And then she partners with a molecular biologist, Malcolm Collins, who had been a patient but not treated patients. And then you get pioneering studies of the genetic association with tendinopathy. So it's a simple concept, and we call it the column A and column B approach in Vancouver. That's not our most innovative title, but you have to be prepared to work hard and learn the other language, and that's the true engagement, which is the tricky part there. You can't just expect them to send in a paragraph for your grant and everything takes off from there. So the summary is that these dimensions of innovation are something to think about. I'm going to touch on the macro environment in a minute more so, but this point of outliers, being exposed to a great environment, you will see those analogies. You look around, you see people from the Australian Institute of Sport, lots of examples of being in a great environment. So it's not a selfish thing, it's not like I'm great, it's like I was lucky to get some success because I was in an important place, is the sort of mantra that I think people will acknowledge if they think about it and take it from there. Okay. So the take-home message for that part is get in a good environment, acknowledge other people's support and roles, because really that's critical. And I'm going to ask Dennis to move us over to the second section. And I know you're dying for that second participation activity, but it's almost there, so don't fret. So thanks, Dennis. So we're moving into teams now, and we'll just enjoy this little clip about a scientific approach to teams. Some of you will have seen this movie, obviously, but, or read the book.
There are rich teams, and there are poor teams. Then there's 50 feet of crap. And then there's us.
That's $1, man.
What?
Welcome to Oakland.
I need more money.
We're not New York. Fine players for the money that we do have.
I like Perez.
And an ugly girlfriend. Ugly girlfriend means no confidence.
You guys are talking the same old nonsense like we're looking for Fabio. We got to think differently.
Who's Fabio?
Your goal shouldn't be to buy players, your goal should be to buy wins. And in order to buy wins, you need to buy runs.
Who are you?
I'm Peter Brand.
First job in baseball?
It's my first job anywhere.
We're going to shake things up. Why don't you walk me through the board?
I believe there's a championship team that we could afford because everyone else undervalues them, like an island of misfit toys.
We want you at first base. I won't ever play catcher. It's not that hard, Scott. Tell him much.
It's incredibly hard.
He can't throw. But what can he do?
You want me to speak?
When up, when do you get?
He gets on base.
We are card counters at the blackjack table. We're going to turn the odds on the casino. I'm heading in. Text me the play-by-play.
Wait, what?
I watch the games.
Billy Bean has tried to reinvent a system that's been working for years. It was a nice theory, just not working out.
And how long is Billy Bean gonna last?
He's proven himself right out of the job.
in their minds, it's threatening the game. It's threatening the way that they do things.
Hey Daddy, do you think you'll lose your job?
What? Where'd you hear that?
Like go on the internet sometimes.
Don't go on the internet. Watch TV or talk to people.
You're discounting what scouts have done for 150 years?
What the hell am I doing?
What is happening at Oakland?
It defies everything we know about baseball.
Just plain crazy!
If we win with this team, we'll change the game. This better work. I'm just kidding.
Thanks, Dennis. So, my wife said she wouldn't show up for the talk unless I had Brad Pitt in it. So, we're moving on to the team success, the second section, and I'm conscious of time, but the point of that obviously was the parallel that when we're in team settings, do we use the evidence, or are we doing like those scouts where they're saying one of the players had an ugly girlfriend, so that's a worry, he's probably not a very good player. And I don't want to be sexist or anything, so you might have had an ugly boyfriend as well. So it's the same principle, but the point is that are we going to the evidence on teams? And it's interesting because this advertisement came out just a couple of weeks ago for a conference where they talk about learning from teams and applying team principles. So I'm going to take the liberty to just spend about 10 minutes on some reading related to how we can get teams to work, which clearly is relevant in clinical practice and in research and in advocacy. And I see ISPA as having an important role in these different physical activity movements potentially. So you were dying for that second participation activity, and it's the same deal in terms of I want this side of the room, so this is your left of the room, please, just to mix it up, to think about your most successful activity and to share that with the person next to you, and then say what you think the key was to that. And then for this side, we're actually going to go with dysfunction, and it's meant to be the right side of the room. So this is the dysfunctional side, well, not literally. If you could just take on the dysfunctional issue, that would be great, and we've got 2 minutes to do that, please. So just the primary thing for success on your side, and the primary side for dysfunction over here. Over here, that good coach, making the most of what you've got, clear communication, determination, they were things I heard. Adrian, did you want to add something? You good with that? No, I was serious, good to get help. Common goal. Okay, so Adrian said common goal, so that's interesting. He's a very smart guy, that Adrian Bowman. And he said common goal, and on this side, on the dysfunctional side, it was communication, breakdown was a common one. And someone want to add something I think is really critical? No? And individual over team, right? So they weren't buying into the goal, and then we heard about buy-in, this idea of buy-in. So again, people here are smart and have had a lot of experience, so I don't want to make it teach you how to suck eggs, as they say in Australia. Clearly the relevance of this is obvious to those of you. We've all been in these settings, so it's relevant across what SMA does. And this was a team. Just an illustration of the team. But this team had 32 pretty good years, but then it didn't go so well at the end. Okay, so they've all taken, TV watchers all like this one, and I guess this was, my wife sort of helped find these pictures. I think this is her idea of her leadership ideal team. But that's me as the old guy on the far left over there sitting down in the chair. Okay, and there's conferences on this sort of thing now. That was the second conference on team science, and there's been one in Europe, and that was in 2011, so they're up to there's one since then that we didn't go to. So we've given this some thought, and there are issues such as when you actually need a team. Now, I'm not going to go through these 5 in detail because of time. I'm just trying to flag this today as something people might want to follow up and read more about. I'm going to come to a couple of key issues, but not these ones. But you don't always need a team. Like trying to write a sentence as a team is a nightmare. And so sometimes it will work. So A working group is where you just get a bunch of people, they do one component, and then they deliver that component to another group, and you stick the two components together. You don't need to add any extra go. That can be just fine and very efficient. And Katzenbach is another name in this particular field. But what I'm going to focus on is the work from Hackman, Richard Hackman, who has the book Leading Teams on the left, and then we'll do the dysfunctions to finish with. But Hackman's the Harvard guru on this stuff, and his bottom line is that you have these three central elements and then the two arrows around that. And you'll see that Adrian's point about the compelling direction is actually the number one thing. So they're all in triangles, but his work and the work of Katzenbach, they make the point that if you have a compelling direction, it actually overcomes some of the communication stuff and people don't like each other's stuff. Those things we often worry about. And if you think about your own experiences, often people who aren't that getting along that well, they've got the common enemy and then they'll get behind that and they can make the compelling goal work. And then once they reach the compelling goal, then they start fighting again because they don't have the compelling goal anymore. You know, so I've really seen that to be the truth. So when I've been in situations when there's different sectors, I look to see what could be the appropriate compelling goal for this group. It sounds obvious, but it'll be different for different elements. And so then you've got to try and tease out what's the significant compelling goal that brings them all together. And so you're moving forward to this compelling goal. The enabling structure is like processes. So if it's in a research environment, if you get someone chasing the CVs of the co-investigators and doing all those sort of things for you, that's an example of an enabling structure. In a clinic, it's easy booking and referral systems, making sure you can get crutches, things like that. So that's enabling structure. I'll move from there to the supportive organisation. It differs from the supportive organisation who's more, the enabling structure is more micro, it's in the team. The supportive organisation would be like the health services, where the Australian government is enabling exercise physiologists to deliver physical activity programs. That's a macro level supportive thing. If the university is fantastic and supportive and respects faculty and provides staff and chairs and things, then that's a supportive organisation. The last one on that graph is the real team. And what they mean by a real team is that you do engage with each other. So it differs from the working group. So if you look at people crossing a street for a traffic light, it looks like they've got the same goal, but really they're not engaged, obviously. And in a real team, you've got to take a risk and put your component out there, relying on other people to be there for you. So the Cirque du Soleil is a good example where you need the other people to be doing what they're doing, and it provides much better value for the customer than if people were doing their own little bits. But literally, if the other person isn't there for you, you're going to be in big trouble in the Cirque. And in a research grant, if you're really engaging and learning the other people's work, and then you get a much richer product. So that's the real team element. And Hackman is a consultant, so expert coaching, he's going to put that in, gets him some work for the next 20 years, so that's fine. But in the sporting sense, we know that coaching is critical, and in fact, people brought that up. But the coaches have to do something. I think they have to keep articulating the compelling goal as well as the other levels of coaching, making you better at what you do. And the other important slide, so the meat, there's a little bit of cognitive work in this lecture, which you'll be comfortable with, and it's like, how do you identify success for a team? And this 3 levels is quite good, I think, because it means that if we're talking about a clinical situation where you might have the shareholders, for example, or people who own the clinic, they're making some money. The team grows in capacity, so you're getting better at working together between the different departments. And then obviously you want to grow as an individual, and these are the things you're often weighing up when you're deciding how to allocate your resources. So to think of a 3-level outcome can be quite useful in a team setting, which is different to when you're an individual. So I think that's a critical slide, both the key elements and the success criteria you're going to set up as leaders. And a couple of good examples. The injury prevention people will know about FIFA and FMARC getting the 11+ an injury prevention program going. I've highlighted Oslo Sports Research. I think they're doing a tremendous job. I think NISPA has done a great job, and I'd say that the global efforts to get the 150 minutes adopted is a great example of success. And obviously by putting the last bullet there, someone might say, well, I'm going to tell the people in England about you saying that. But I read a book about the history of the British sports medicine situation, so it's fact-based, this isn't emotion. And there was a lot of there was basically the Spearman camp and the Williams camp, and whenever the government wanted to do something for sports medicine, the two camps would shoot each other down, and then the government would walk away and go, bugger it, we're not giving you any of it. And so there was this dysfunction between the team members, and so they didn't progress the way other countries have progressed in that phase. So they're factual things out of a book, and it's not the current people who are running DASM who I have relations with. Okay. So one quick point is that what's the optimum number for a team? And again, I'm not trying to be like Hitchhiker's Guide to the Galaxy or anything, but as the evidence from work studies is that the first person in any situation creates the most work, and then the people after that add incrementally because there's these costs for communicating. And if you've tried to organise a meeting between 7 busy people, you understand how long it takes just to get the emails to work. And so the second bit there is the process losses that you're weighing up against as you get more people. So the net is the bottom graph, that the actual productivity is best around 5. Now, it's got a confidence interval around it. Obviously, it's not meant to be 5.0. But interestingly, if you think back to when you've been in successful environments and go, well, how many of us were there? You might find that it's around the 4 to 7 sort of mark. And then you say, well, what about Apple? I think they probably employ more than 5 people. And I think you're right. But then you break them into units and get the units to work together efficiently, and then you bring people from the units together. So I think this has been an interesting concept that's evidence-based, and it's been reinforced in stories I've heard from people who have run successful things. So all these points I'm trying to bring tonight are just catalysts, food for thought. I'm really acknowledging how expert people are, how much wisdom there is in the room, and hopefully it'll be the source of, some elements of these will be taken by different people for either reading more about or discussing and getting superior input. So I'm more like a guide at the side rather than a sage on the stage, which I heard someone say. It's a bit cheesy, but I thought I'd give it a try. Okay, so that's the team. And then the last bit here is the dysfunctions. And really, this is critical. So what I've done is Lencioni, who's written at the bottom, Lencioni, he's got the book 5 Dysfunctions of a Team, which will come up again. I think that's very interesting. If you know what the dysfunction is, then you can potentially cure it, like a clinical scenario. And the one I'm going to ask you to focus on is fear of conflict. And it's not such a big deal in Australia because they don't mind telling people what they think in Australia. But in Canada, this is a tough one because there's a lot of tippy-toeing around telling someone that they're wrong. And so that leads to this situation where there's artificial harmony, and then what happens, things don't move forward because the person who's not really happy just sabotages things at the back, and things don't go forward. So this is an absolutely critical thing, this fear of conflict and artificial harmony. Of those 5 issues of Lencioni, it's the one that I've worked hard to eradicate in the sense of encourage. I use the word safe place a lot, and with my graduate students I tell them that I'm often wrong, and then if I'm not getting back to them on their stuff, they need to email me again and just ask for it again. So I sort of make it very horizontal in terms of relationship and really encourage people to articulate their discomfort and disagreements. And then once we've made a decision as a team, then we move forward, and then there has to be buy-in. And if I haven't got my way sometimes, most of the time, then once we've agreed on the new thing, then I'll move forward, and that's being part of the team. So that's critical. It just maps across to some positive things from Hackman. So I like to sort of avoid silos, and you've got 2 authors on teams, and actually there's a lot of cross support of the concepts that both of them have got to from different evidence bases. Okay. So that's the 2 books in particular. And then the last one, this is a bit controversial here. So the word psychopath is often used, and we think of, in Canada, there was a guy in a Greyhound bus who cut the head off of the person sitting next to him. And that's the traditional, thought of the word psychopath. It actually happened. It was, they started eating the head. So everyone got off the bus and they weren't happy. Now, what Hare says is relevant for us is that there's a border, that it's not just that type of psychopath. So let me just take you through what Hare, he's got this book called Snakes in Suits. And it makes the point that in work environments, people like this can exist, and actually because we reward certain behaviours that academia and lawyers and probably doctors, you can be rewarded and still be a psychopath. So this is an interesting read. And then they have these characteristics here, and that's the short version of the Hare scale. You get 2 if you lack remorse, for example, and don't accept responsibility. And so you get that scoring system. So if you're 24 on this scale, then that's not a good thing. And the reality is that does happen. Now, a milder form of that, is narcissism. And again, I'm getting out of my comfort zone. I'm not a psychologist, but again, I'm just flagging, like reading and work from a couple of relevant groups, with the point being, sorry, there's this curve. Just want to get back to this normal curve there. That we are going to run into these people, and so. Why is that important? Is if you're alert to them. There's one school of thought where say if you can't say anything good about someone, don't say anything. And I actually don't buy that argument, to be honest. That argument, like your mum says, if you can't say something good about someone, don't say anything. The problem then is people who are absolutely dysfunctional can do that in a series of places. And that's how, when priests sort of did paedophilia on children and everything, as a matter of people, not spreading the word because there was a shame associated with that. So, these are just facts, and there needs to be a safe place to discuss these things. So, spreading gossip and being emotional about people, things isn't real. But you're sharing a fact and saying, the person didn't get back and didn't contribute their part on the grant, or the person did this. Like, if you're just sharing facts as you appreciated them, then I think that's the important thing to share with people. And we've all had hirings where we've hired someone who's been sacked somewhere, and then they said, they're okay. So I think it's a matter of being alert to knowing that the normal distribution exists in biology. It's going to occur in psychology, in social skills and psychology. And so in a leadership role, you want to try and be alert to that and avoid and network appropriately. Do your homework on HR. It's one of the principles of HR, of doing thorough background searches and checking up the references. Okay. So I'm conscious of the time. So we're going to move on to we're done on the second part, except this is important. When Neil Armstrong died, he didn't quite get it right on NBC. And some of you know Crosby, Stills, Nash and Young, and Neil Young's he's Canadian actually, and so that wasn't, he's still alive, you'll be pleased to know. And they also said that Neil Armstrong was the first woman in space, which was not fair for Sally Ride. Okay. So we're going to move on to the very last section. Dennis, thanks for your help here. And I can be conscious that I've got 7 minutes according to this schedule. So we're on to part 3, implementation, which I think, I see that as a form of success. So that's why I put it in the success scale, that we're scaling up, to use a word that Heather's educated me about the last couple of days. So implementation of success. So these things are getting to a more macro scale. I had a couple of slides about Sir William Refshauge, and clearly I put it in the implementation section because he made things happen, and that's a tremendous contribution. Now, I'm going to take a skip on this video to save some time. Can I just get a show of hands? Who's seen this video of 23.5 hours that many of you sent out for Christmas cards as well? So that's great. So it's a fun video, and I direct those who haven't seen it to it. It was just meant to be a hook for implementation. And if you click on it, just a little hook into Twitter. So those of you that are following the Be Active hashtag are just showing Twitter in action. We can direct people to click on that, so that's fine. And then Bill Cole is engaging in Twitter. So sort of a resourcey thing saying that we can communicate through Twitter, just an example of how we can get these messages out. In this case, the message about the that YouTube video, and making the point that we're trying to implement physical inactivity avoidance, that's fine. And then in terms of resources, there's a podcast with Mike Evans who did that 23.5 hours video, and Dan Heath on BMJ. So if you Google a BMJ podcast, like it says there, you can get to a discussion with Mike Evans and Dan Heath about implementing health behaviour change. So some resources for implementation. It was good that David Letterman got into the idea that exercise is the most powerful medicine. And what he did was he suggested that if we group smoking, obesity and diabetes as smoker diabetes, then we could compare how that was compared to low fitness, like what kills the most Americans. And he found Steve Blair's data to show that low fitness actually kills more Americans than smoker diabetes. So on the y-axis you have attributable fraction, and you see that the men and the women in those two bars is around 16%, and in the smoker diabetes group it's not as dangerous as low fitness at the population level. And you heard from Ken Powell about physical activity, so the purpose here isn't to talk about the benefits of physical activity, it's about implementation. I heard lots of good things in the room, such as changing the built environment, as improving people's education, and so what we're up to, sorry, that was, you know, these sort of things I actually did here, and this is it. So, hang on, someone's coming from the audience. Leave me alone.
No, but just taking over the meeting now briefly. The ISPA Council, GAPA, has got 7 best investments, which are the exact things you say to your minister in 2 minutes. There's only 7 of them. Which of the 7? It's number 8, which is all of the previous 7. Thank you.
Adrian, come back with the piece of paper. There we go.
We have postcards of it, and we have bookmarks of the 7.
It's amazing, I've never been assaulted at a meeting before, but it was like the pilots in China when the people couldn't get on the next flight. Okay, so, you know, interestingly, this wasn't a plant, and so absolutely, and it's not a plant at all. And when I was talking to Fiona last night, I hope I've got this quite right, but we were at the same social event, and she said those things. Is that pretty accurate, Fiona? Yeah, okay. And this is where we're at. So we've got to move away from telling people they know physical activity is a problem, and we're trying to get it sorted. Now, my point, you know, I've thought about this lecture a lot, as you know, and I think we've got a problem that we've got too many competing solutions. And so if we go back to the list that I put up before I got assaulted, you know, that there were quite a few different things, and different people had different bits. Like the built environment people were saying we've got to improve the environment, and the education people were saying we've got to improve education. Now, what happens when those, in this room we'd all be collaborative, and this is where the teams come in and the leadership and the compelling goal, but what happens when you get a built environment person who's only thinking about that? They go to the minister and they say, look, you don't want to listen to those education people, you know, that's bullshit, that doesn't work, here's some evidence why that doesn't work. And so then you're fractured, because then when the education person comes back and says, those built environment people, like it costs millions of dollars to do that stuff, you just want to educate the kids. And so we've got to be cohesive and not divisive. And I'm going to celebrate the good things here. I'm not saying these groups are divisive at all, these are fantastic things. I'm just going to run through a few different things that you know. The BJSM's happy to be a facilitator of these things and spread the word, so we got behind the 7 investments and appreciate Fiona letting us publish it. For those of you who don't know, the 7, you know, the overarching one is public education, including mass media. I've grouped these in my own way, so I might get in trouble, but the way I group them is that there's this overarching one of public education and mass media, and this is a great example where FIFA, you know, had these ads. Like, they cost millions of dollars if you wanted those at the World Cup with that sort of exposure on television, like 17 billion people watching it on television. And, okay. Then there's the built environment and transit, so they're 2 different of the 7 habits, and they're on this card that Adrian brought up. And then you do it in different settings. And I heard people say schools, I heard people say the workplace, I heard people say sport. And when people say those things, they need to say this is all part of the 7 investments and we're all cohesive, because whatever you do as a government, you don't have to do all of them at once, just do each bit. Every time you go to one of these sectors, you know, implement some of this and then we'll give you credit. And then the last one is the health professionals, you know, in the health setting, and here the exercise physiologists are doing a great job in that. So you can see the 7 flow together logically there nicely in 4 bullets. So that's fine, we don't need to labour that here. A school example from Canada, and another nice one from Netherlands, where they worked in the teenage setting. So it's community engagement to make a difference. Okay. So that's fine. And the health professionals, I was just illustrating those, but you get that concept. So, but there has to be a compelling goal. And here we've got the US physical activity plan. So if you're thinking this guy's really disorganised, like he's putting up all these slides, what's he doing? this is just a small part of the landscape, and so you wonder why the ministers are confused, you know. And so there's a lot of parallels. If you look at these across the top, there's the healthcare, public health, they fit nicely with the 7 investments. So we've kind of got to get behind one of these things. The Swedish have got their own fantastic book on how to improve, so that's a healthcare one that can come in under the healthcare side. And so, you know, lots of great suggestions, but so what I would suggest is to finish, is that we've go back to the evidence again, and in terms of persuading people to do stuff, there is a nice paper by Cialdini, which has actually been called the most cited paper ever, which I find hard to believe, but he has got a science of persuasion, and so he talks about these 6 principles. Again, I'm not going into this, the purpose is just to alert people to Cialdini and to think about these things. This is if you're trying to persuade your kid to brush his or her teeth, there's evidence to support each of these from the psychology literature, and I focus on a couple that I think will work for physical activity, especially at the political level. And this one is to say, if we say the World Health Organization have agreed to this, then that, you know, could help, and say that there are all these countries involved in moving physical activity forward. So I think the social proof one, I'm just going through 3 that I think are particularly important. Social proof. The consistency would be to tell people, the ministers, like, you did a great job on that program where you got the schools to be more active. And if we really celebrate that as a lobby group, we can make them feel that they need to be consistent with that sort of behaviour. But we've got to have a voice. That's why we've got to be aligned, and we've got to get, you know, if we have something like a Twitter social media campaign, we've got to have a communication channel to have weight with the politicians. And in Australia, they had the Alan Jones thing just recently where they got 90,000 people on Facebook to tell people, Alan Jones, you know, what they thought of him. And that had a lot of weight, but you've got to mobilise forces, but social media can help with that, which is why I think it's an important topic tomorrow. And the last one that I'm going to focus on is authority, which again, by saying the World Health Organization bought into it, that could hopefully help a government. So that's it for those ones. The last thing I'm just going to finish with is to say that these models that we, the very last sort of model that I find useful in behaviour change, and we'll skip the Rocky theme song, is, who's read this book called Switch? Just to show of hands who's read this book. So hardly anyone's read Switch. And the point of Switch, and this is the last bit of implementation here, okay, just a behaviour change model that is a very simple one. So the ones before that I got rid of because I think they're complicated, but this stuff from Heath is simple. The key point is that we're not as rational as we'd like to think we are when we make decisions. So if you bought a Hermes bag or a motorbike or an expensive car, you would agree with that. And he breaks it down to 3 points. You've got to motivate the elephant, which is the emotion, engage with people's emotion first. And I think people know that physical inactivity is a problem. So we're up to number 2, direct the rider, and that's to give simple solutions, which is what this is. And the third thing is make the choices easy, okay? So there was a lot of talk about elephants in the room, and this is the basic brain is the powerful elephant, and so it has to be guided. So this is the point here is you've got to buy into people's emotion. Okay, there's a tweet that's come through. Someone's not happy out there, obviously. But we're just about done on the elephant because it's the key point, this is the important message. If you're trying to change behaviour, as scientists in all our training, we tend to go back to the data, like more data, convince people with more data, and that's not how you convince people. And so we've got to get emotion, and I'm going to not talk through this one. That will bring up a lot of feelings in a lot of people. I know why that was an important photograph. 30, 40, 50 years later, this is an important photograph. There's data. There are data. Graduate students, my apologies. Okay. Now, I'm very conscious here, this is tricky and appreciate your time. I'm very conscious of the emotion of around 9/11 and hugely respectful of those people. And just the fact I have to show that shows how much emotion there is. And 9/11 was a global problem. It affected 3,000 of us as world people. It wasn't an American problem. And so you've got 177 people dying every year for every person who died in 9/11. And we're having trouble getting physical activity on the agenda. So that's the point about motivating the elephant. The second point is to not just get more data. Like here we've got the fitness levels, the community going down with the red arrow. We've got more papers saying that physical inactivity is a problem, but we've got to get this policy and advocacy stuff done. So this is where my take-home message from Heath is that we've got to do more directing the rider. And what Adrian did is he came up and he directed the rider and said, here, you've got the GAPA document, so we can all come in under that umbrella, which is a great document. We've done well with 150 minutes a week. It's time to move on and get all these people into the one tent. I think it's a great role for ISPA, because otherwise people get confused. That's the sort of example of the many different offerings that are out there, but we've got to get aligned. And the last bit is just, if we can make it easy for people, that's fine, but that's not my sort of take-home message. So shaping the path is making choices easy. So the summary is that we're all agreed that we need this socio-ecological model, like we've got to hit it at different levels, but if different people at each level are fighting each other, then we're not going to get anywhere. Switch is important because it tells us to direct the rider, and I will play this last video to finish. It's just a short one, but it's a 1-minute video. And Dennis, if you could give us this last video. The point here is give clear messages with emotion, and then I'll be done. Okay, so well before that. That's weird, eh? Okay. We will... no good, Dennis? It's weird. Not to worry. That's fine. You got the concept. Everyone in Australia knows the powerful drink driving ads anyway. It was a chance to share those with international people, but they're renowned for their power and clear messages about if you drink and drive, you know, your mum will be disappointed. You really wreck a lot of lives is the bottom line. Okay. So then we can get things done and get more change than you might think. You know, if we get these things aligned, so there is a possibility to do a lot of really good work. So the last slide is that, you know, people said that Neil Armstrong couldn't get to the moon and people couldn't do that, but hey, I'm going to leave it there. Thank you very much.